Is a recumbent bike good for back pain and spinal stenosis? I'm Dr. Dave Candy, and in this video, I'm going to explain that a recumbent bike is in fact good for back pain and spinal stenosis, and how to use it and when to best use it to recover from back pain and spinal stenosis as quickly as possible. So first of all, why is a recumbent bike good for back pain and spinal stenosis? Well, one of the most common problems that people with a lot of type of back pain, especially spinal stenosis, have is walking. And exercise is one of the best things that you can do for lower back pain. And walking or other forms of aerobic exercise are great things to do to help improve the blood flow to your spine, to your nerves, to your discs, to help get the nutrients and oxygen that they need to heal. But if you have trouble walking, then you're not going to be able to heal as quickly if you can only walk for a few minutes at a time, which is a really common complaint for people who do have spinal stenosis. So using an exercise bike or other forms of exercise where you don't have to be standing for long periods of time is a great way to help recover. Now, what about an upright traditional exercise bike? Well, when you ride a traditional exercise bike, because of the way the seat's oriented, you have to have your back up nice and tall, your back's arched, and that kind of jams the joints in your spine together. It can cause some facet-related back pain, or it narrows the spaces where the nerve roots come out of your spine, and it can contribute to spinal stenosis. So you don't really want to have your back arched like that. It's probably better than being upright and walking, but ideally you should be able to round your spine out a little bit. The nice thing about a recumbent bike is it allows you to kind of rest back into the backrest. That's why they call it a backrest, because it allows your muscles to relax. It allows you to kind of get your spine into a little bit more rounded position, which opens up the spaces between the joints and opens up the spaces where your nerve roots come out so that you can exercise and get the nutrients and oxygen and blood flow that you need to help you recover from back pain and spinal stenosis. So how do you use a recumbent bike to help with back pain and spinal stenosis? Well, because being in a position like this with your back arched jams the joints in your lower back together and compresses on the nerve roots, you want to make sure that you're all the way back up against the backrest so you can allow your muscles to rest into the backrest. That also opens up the spaces between your joints and opens up the spaces where the nerve roots exit your spine, so you don't get the pinching and pain in your legs that people with spinal stenosis typically complain of. Now, if you're too far away from the pedals and you really have to reach to get all the way out to the pedals, you can see there's a gap back here between the seat, which you don't want. So you want to make sure you get close enough that you're able to sit all the way back up against the backrest with your back at a 90-degree angle roughly. And that helps open up the spaces between your spine where the nerve roots come out, and it helps you get blood flow and oxygen that you need without getting the pain and burning in your legs that you might get when you're walking for long periods of time. Now, what about walking? Ultimately, we don't live on recumbent bikes. We stand and walk through the world. And if you want to be able to stay independent, go out in the community, go to the grocery store, take care of your home, you have to get back to walking eventually. So how do you do that? Well, when you're walking, you just want to walk up to the point that you start to develop symptoms and then sit down and rest. Now, you may have to break up your walk into a few shorter periods, say maybe 3 bouts of 5 minutes apiece. So instead of walking for 15 minutes or 30 minutes, you might start out at just doing 3 sets of 5 minutes and then building up from there, either adding more sets of 5 minutes or stretching those sets of 5 minutes into 6 minutes or 7 minutes as you progress, so you can get back to the 15, 30, an hour that you want to be able to walk. Now, if you can't get as long as you want to be able to go and you still need to make up some of that exercise time, then walk for the duration that you're able to, and then make up the rest of the time on a recumbent bike. And that way you get the functional ability to walk and also get your full exercise duration in so that you can get, again, the nutrients and oxygen that you need to be able to heal properly. Now, one of the bad things about a recumbent bike is that it does make your hip flexors stiff. And that's true whether you use an upright bike or a recumbent bike, because you don't get all the way out into full hip extension like you do when you're walking. But the good news is that after you've used the bike, that your muscles are more warmed up and you can stretch them a little bit easier. Muscles are a little bit more flexible after they've been warmed up. So after you use the recumbent bike, in order to avoid getting your hip flexors even stiffer than they might already be, doing a hip flexor stretch where you stand up and have one leg in front and stretch, where you feel a stretch right there in the front of the hip flexors, is a good stretch to do after you've used the recumbent bike. So hopefully you found this video helpful to learn how to use a recumbent bike to help with back pain and spinal stenosis. Now, if you happen to need some more help for back pain or spinal stenosis and you live in the St. Louis area, we'd be happy to help you out at More for Life. And if you're watching this video from somewhere else but you found it helpful, give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.